Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. Now let us learn about the complications of twin pregnancy. So in the complications now we are going to learn about the complications of twin pregnancy. So in the complications of twin pregnancy, first we will learn about the antenatal complications, first maternal complications and then fetal complications. If you wanted to learn about the maternal complications and then in the maternal complications, first we will have to learn about the fetal antenatal complications. And in the antenatal complications, we are going to learn about the first trimester complications. Any complications which are seen in the first trimester. So if you see in the first trimester complications, this is the uterus. These are the two babies. So because of the presence of two babies, there is increased beta HCG. This increased beta HCG will cause increased vomiting, that is hyperemesis gravidarum. So that is one of the complications of antenatal complication. And then because there is increased more number, two or more babies in the uterus, so because of that there is a chance of spontaneous miscarriage which may occur in the first trimester. Okay, then if it's in the second trimester, then because of the two twins, there can be increased risk of gestational diabetes mellitus and also increased risk of hypertensive disorders, any hypertensive disorders, and also there is increased risk of anemia. Okay, so these are the different risks in the second trimester. Now, what about the risks in the third trimester? So if you wanted to see in the third trimester, mainly if you see because of the presence of two twins, okay, there is more amniotic fluid than presence of one twin. So there is increased chance of polyhydramnios, and also the one of the placenta can get inserted in the lower pole also sometimes. So there can be a chance of placenta previa, or even sometimes there can be early disruption of the placenta from the placental blood vessels and uterine blood vessels. So there is a chance of abruptio placenta. Okay, there is a chance of abruptio placenta, and then along with that, because of the presence of increased, two twins, twins, there are twins, so there is increased weight than normal. Okay, the weight of the twins is increased, so weight of the uterus is more. So because the weight of the uterus is more, these contents in the uterus, these will apply pressure over the uterus. Okay, and this will cause uterine contractions. Because it causes uterine contractions, there is a chance of having preterm labor, preterm delivery. There is a chance of having preterm delivery. So this is one which we have to keep in mind. And then there can also be pressure symptoms. What are the pressure symptoms? Because this might compress the diaphragm. If it compresses the diaphragm, this can cause breathlessness and respiratory difficulties. If it compresses the gastrointestinal tract which is present on either sides, in such cases there can be GI symptoms. It can also compress the inferior vena cava which is present. If this is the inferior vena cava and uterus will be somewhere here, right? So this uterus may compress the inferior vena cava and this can also cause pedal edema. Okay, so these are the different complications, that is antenatal complications of twin pregnancy. Now, what about the intrapartum complications? What are the complications that are seen in the intrapartum or postpartum complications? In the intrapartum complication, that is in first stage. In first stage, if you see, the major complication is presentations. There can be malpresentations of the babies, that is one. And because the uterus is very big, sometimes it cannot contract. it is not able to contract. Because it is not able to contraction is not possible here. There will be the contraction which is there, this is not happening. As a result, there is prolonged labor. Okay, as a result, there is prolonged labor. And then there are also malpresentations, as I have said. Because of prolonged labor, we will have to augment the labor with the help of oxytocins or something. So as a result, we will have to augment the labor. That is one more complication. And then there is there can be premature rupture of membranes can also occur, and there can be also the cord, it may prolapse. There can be cord prolapse also outside the uterus. Then in the second stage of labor, if you wanted to see in the second stage of labor, mostly there is a chance of usage of instruments. Assisted vaginal delivery must be done. We can use forceps or vacuum extraction, or assisted breech delivery should be done. If it's third stage, now in the third stage there is an increased risk of postpartum hemorrhage. Most commonly, atonic postpartum hemorrhage is more common, because the distended uterus, now it is really difficult for it to contract. Okay, inadequate uterine contractions. And in the postpartum, there is an increased risk of thromboembolism. And in the postpartum, there is increased risk of thromboembolism. Okay, so these are the different complications of maternal complications of twin gestation. Now, what are the fetal complications of twin gestation? The major fetal complications of twin gestation include, they can be congenital anomalies, presence of any congenital anomalies, or there can be intrauterine growth restriction can occur, or sometimes there can be premature labor leading to premature delivery, so there can be prematurity. So these are the different complications, that is fetal complications of twin pregnancy. Okay. Now, how are we going to what are the other complications of twin pregnancy? The other complications of twin pregnancy, the other complications of twin pregnancy include, just a minute, yeah. The other complications include, mainly there are some complications which are seen in seen in monozygotic twins. There are some complications which are seen in monozygotic twins. So in the monozygotic twins, if you see the complications like there can be complications of monoamniotic twins. Okay, or there can be twin to twin transfusion syndrome, or there can be twin reversal arterial perfusion syndrome, or there can be twin anemia polycythemia syndrome, or conjoined twins. Okay, so there can be monoamniotic twins, there can be twin transfusion twin to twin transfusion syndrome, twin reversal arterial perfusion syndrome, twin anemia polycythemia sequence. I'll just explain about each of them in detail. So think that this is the uterus. Okay, so now this is one baby, this is second baby. Okay, the two babies, if you see in twin to twin transfusion syndrome, in the babies, the artery of one baby, it is connected to the venous channel of the other baby. Now, because the arterial channel of one baby is connected to the venous channel of other baby, okay, in the placenta there is artery to artery or vein to vein connection. So there is artery to artery and vein to vein connection. So because of that, in twin to twin transfusion syndrome, there is artery to artery and vein to vein connection syndrome. I'm sorry, this is also artery. This connection which is there, this is also arterial connection. artery to artery connection or vein to vein connection. Okay, so because of the communications, the pressure of both artery to artery and vein to vein are equal. Okay, because there are communications between the artery to artery and vein to vein communication, the pressure gradient will become equal. Okay, so the blood supply of the fetuses will not be compromised. This occurs normally. Normally there is artery to artery and vein to vein connection. But if think that there is this twin to twin transfusion syndrome. In twin to twin transfusion syndrome, if you see, there is not artery to artery or vein to vein connection. There is artery to vein connection. In twin to twin transfusion syndrome, there is artery of one twin gets connected to the venous channels of the other twin. Because artery of one twin gets connected to the venous channels of the other twin, now the blood from this twin will reach this twin. The blood from this twin, it will reach this twin. Okay, now because of that, this twin which is giving its blood supply, this twin is called as donor twin, so it will become IUGR. It will become, if you know, if this is called as donor twin, this donor twin will have fetal growth restriction, because all the blood, all the nutrients that this twin has to receive, this is supplying, this is donating it to its other twin. So because of that, the other recipient twin, this will become macrosomia, and it will have, so this has less blood. If you see, this has less blood, this has more blood. This twin has more blood, whereas this twin has less blood, right? So because this twin has more blood, there is an increased chance of having polyhydramnios. Here in this recipient twin, there is a chance of having polyhydramnios, and then there is also, because of this increased blood, there is increased viscosity, hyperviscosity. This will lead to congestive cardiac failure. Okay, that is what we see in this twin. Then what about the other twin? In the other twin, this other twin has become small now, right? It has all the blood, that all the nutrients, all the blood, all the oxygen it should receive, it is just sending it to the other twin. So as a result, this twin will have oligohydramnios, and this twin will have fetal growth restriction, and also there is, because of oligohydramnios, complications of oligohydramnios like contractures or pulmonary hypoplasia, all these are seen. Okay, so this is about twin to twin transfusion syndrome. Okay, this is, what is this? This is called as twin to twin transfusion syndrome. Okay, now how are we going to treat, how are we going to identify this? This is identified by ultrasonography. Okay, we identify this twin to twin transfusion syndrome by ultrasonography. Once we have identified this twin to twin transfusion syndrome by ultrasonography, how are we going to treat this twin to twin transfusion syndrome? There is expectant treatment for twin to twin transfusion syndrome also, that is mainly done for stage 1. The twin to twin transfusion syndrome, it is mainly divided into 5 stages. Among the 5 stages, in the donor twin bladder is visible. In first stage, donor twin bladder, that is urinary bladder, it is visible. That is the first stage. Second twin, donor twin bladder is not visible, but Doppler which is there, that is normal Doppler. In third twin, there is abnormal Doppler, but there is no ascites or no signs of congestive cardiac failure. Fourth twin, there is ascites to the twin, and there can be hydrops fetalis also. In fifth stage, there can be death of one twin. Okay, so these are the 5 stages. So in the first stage, we will just do an expectant management. We can wait. Okay, in the first stage. Then there are other treatments where we will have to, there is one more treatment which is called as laser ablation of vascular anastomosis. This vascular anastomosis, it has been ablated. We will just burn this vascular anastomosis with the help of laser. So this is the best treatment. Sometimes you can even do a septostomy, where you will puncture both the see, you have 2 amniotic sacs, right? So if you just puncture these both amniotic sacs, then the amniotic fluid will move. As a result, this problem of oligohydramnios and polyhydramnios will be resolved. Okay, so that is one more treatment. So this is the treatment of twin to twin transfusion syndrome. Now in our next class, let us complete the other things also. Now we will learn about one more topic here. So in this we have learned about twin to twin transfusion syndrome. Now the next is twin anemia polycythemia syndrome. Okay, in twin anemia polycythemia twin syndrome, if you see, there is an arteriovenous anastomosis of smaller vessels, not the major vessels, but there is arteriovenous anastomosis of a little smaller vessels. In the smaller vessels there is arteriovenous anastomosis here. Okay, that too in the smaller vessels here, not the major vessels. So because there is an arteriovenous anastomosis of the smaller vessels here, if you see one twin which is there, okay, this one twin which is there, this will have anemia, whereas the other twin which is there, she is receiving the blood, she will have polycythemia. So this syndrome is called as anemia polycythemia syndrome. Okay, how are you going to treat it? Treatment, it is simple. It is similar to twin transfusion syndrome, where you will ablate these arterial and venous anastomosis. The next topic which I would like to discuss, the next complication is twin reversal arterial perfusion. Okay, in this twin reversal arterial perfusion, it is a rarer condition, and here there is a large arterial communication is seen. Here it's not a small arterial communication. In twin reversal arterial perforation syndrome, even here you have two twins. Okay, even here you will have two twins. Okay, even here if you see, there is arterial communication, one artery and one vein, these are communicating. Okay, but here the problem is there is a recipient twin, there is a donor twin, right? So I'm sorry, I forgot to draw this head. Yeah, so there is a recipient twin and there is a donor twin. So this is the donor twin, this is the recipient twin, right? The recipient twin will receive a deoxygenated blood. Okay, this is the donor twin. So first from the placenta it receives the blood supply. So from here the deoxygenated blood is sent to this recipient twin. Okay, so that too in the lower half of the body. So this twin which is there, so this recipient twin, this twin will lack, so the blood from here, okay, it will go like this. Okay, so the recipient twin, so think that this is the donor twin, sorry, this should be vein, then vein gives to arteries, right? So this is the artery. I'm sorry, I'm really sorry about it. Okay, now this is the recipient, this is the recipient twin, this is the donor twin, this is the donor twin, this is the recipient twin. This donor twin which is there, so this donor twin, it will give blood supply to the recipient twin. See, once the donor twin, it is giving blood supply to the recipient twin, right? The recipient twin will receive deoxygenated blood, not the oxygenated blood. Okay, deoxygenated blood is receiving the recipient twin, whereas donor twin, it is receiving oxygenated blood from the placenta. Okay, even here there is a placenta by which it receives oxygenated blood, but will be this oxygenated blood goes to the deoxygenated, this donor twin, and from there it reaches the recipient twin, right? So this recipient twin, because it is reaching the deoxygenated blood, it will lack heart and other structures. So that is the reason this recipient twin, it is called as acardiac twin, that is absence of heart. Okay, so how are you going to treat it? Treatment is expectant management can be done, or you can just laser ablate these vessels. So this is about twin reversed arterial perfusion syndrome. And the final complication which you have to see here in this lecture is conjoined twins. So if you see, the final complication is presence of conjoined twins. Okay, conjoined twins is incomplete division of the embryo, that takes place between the 13 to 15 days of 30 to 15 days of fertilization. It is extremely rare. It is highly motile. Most of the twins, conjoined twins, they share vital organs, and if you see these conjoined twins, they have diagnosis. They are diagnosed by ultrasonography. So this is about the complications of twin pregnancy. Thank you guys for watching my lecture. Thank you.
Thank you and thank you for watching.